by Dr. Supriya Sharma, Chief Medical Office Advisor at Health Canada. The focus of today's briefing is the latest on COVID-19 in Canada, but Dr. Sharma is here in case there are any questions on the regulatory aspect of vaccine approval. Aujourd'hui, nous entendrons les allocutions de la Dr. Theresa Tam, administratrice en chef de la santé publique, et du Dr. Howard New, sous-administrateur en chef de la santé publique du Canada. Suite à la présentation, les docteurs seront disponibles pour répondre à vos questions. Les docteurs sont accompagnés aujourd'hui par la Dr. Supriya Sharma, conseillère médicale en chef à Santé Canada. Cette séance d'information a pour but de faire une mise à jour sur la COVID-19 au Canada. La Dr. Sharma s'est jointe à nous pour répondre aux questions sur l'aspect réglementaire de l'approbation des vaccins. If you wish to ask a question, please press *1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Alors procédons. Let's begin. Over to you, Dr. Tam.
Thank you. And bonjour à toutes et à tous. The latest surveillance data show a continued decline in disease activity nationally and in most jurisdictions. Over the past week, an average of just over 2,800 new cases were reported daily across Canada, and severe illness trends are stabilizing. On average, under 2,400 people with COVID-19 were being treated in our hospitals each day, with over 720 in intensive care units, and 35 deaths were reported daily over the past 7 days. As we approach 90% of the eligible population having at least one dose of COVID-19 vaccines in Canada, evidence continues to show that being fully vaccinated provides good protection against COVID-19 infection and excellent protection against severe illness. However, no vaccine is perfect, and there will be instances of suboptimal protection or breakthrough cases. This is why it is important to remember that vaccines must be part of a comprehensive and layered protection strategy that includes other practices and precautions, as well as ongoing monitoring and adjustments. As part of Canada's ongoing commitment to carefully monitor vaccine safety and effectiveness and to update vaccine advice as evidence evolves, Canada's National Advisory Committee on Immunization, or NACI, has updated recommendations to provide Canadians with the best possible protection against COVID-19. NACI's review of the latest available evidence supports, with appropriate clinical oversight, that it is possible to safely provide COVID-19 vaccine to people who experience very rare, immediate, severe allergic reactions after receiving a first dose. This means these individuals can receive the additional doses they need to complete their primary COVID-19 vaccine series and be better protected against COVID-19. As well, updated information from NACI on optimal intervals between the first and second doses of a COVID-19 primary vaccine series shows that extending intervals beyond those initially authorized leads to stronger immune responses, providing even better protection against COVID-19 infection and severe outcomes. While our protection against COVID-19 has been bolstered by vaccines, as we head into respiratory infections season, we also need to think about protection against other infections. In addition to getting up to date with recommended vaccines, such as influenza and other routine vaccines for children and adults, we can stay healthier by wearing face masks, keeping up with hand and cough hygiene practices, getting the best ventilation possible in our indoor spaces, and staying home and away from others if we develop symptoms. Maintaining our simple, well-practiced habits over the fall and winter will help keep us healthier while easing pressure on the health system for a smoother recovery over the longer term. This goes for planning social events, including Halloween. With a bit of our great Canadian creativity, we can ensure that kids and kids at heart can have fun and safely enjoy this special tradition. Thank you. Merci, Megwitch.
Bonjour à toutes et à tous. Les dernières données de surveillance montrent Une diminution continue de l'activité de la maladie à l'échelle nationale et dans la plupart des provinces et territoires. Au cours de la dernière semaine, un peu plus de 2800 nouveaux cas ont été signalés en moyenne chaque jour au Canada et les tendances relatives aux cas graves se stabilisent. En moyenne, moins de 2400 personnes atteintes de la COVID-19 étaient traitées dans nos hôpitaux chaque jour, dont plus de 720 dans les unités de soins intensifs et 35 décès ont été signalés quotidiennement au cours des 7 derniers jours. Près de 90% de la population admissible a reçu au moins une dose de vaccin contre la COVID-19 au Canada et les données probantes continuent de montrer que la pleine vaccination offre une bonne protection contre l'infection à la COVID-19 et une excellente protection contre les formes graves de la maladie. Cependant, aucun vaccin n'est parfait et il y aura des cas de protection sous-optimale ou des cas post-vaccination. C'est pourquoi il est important de se rappeler que les vaccins doivent faire partie d'une stratégie de protection exhaustive à plusieurs couches qui comprend d'autres pratiques et précautions ainsi qu'une surveillance et des ajustements continus. Dans le cadre de l'engagement continu du Canada à surveiller attentivement l'innocuité et l'efficacité des vaccins et à mettre à jour les recommandations sur les vaccins à mesure que les données probantes évoluent, le Comité consultatif national de l'immunisation, ou CCNI, du Canada a mis à jour ses recommandations pour offrir aux Canadiens la meilleure protection possible contre la COVID-19. L'examen par la CCNI des dernières données probantes appuie le fait qu'avec une surveillance clinique appropriée, il est possible de fournir en toute sécurité le vaccin contre la COVID-19 aux personnes ayant présenté de très rares réactions allergiques graves immédiates après avoir reçu une première dose. Cela signifie que ces personnes peuvent recevoir les doses supplémentaires dont elles ont besoin pour compléter leur série vaccinale primaire contre la COVID-19 et être mieux protégées contre la COVID-19. De plus, les renseignements actualisés de CCNI sur les intervalles optimaux entre les premiers et les deuxièmes doses d'une série de vaccins primaires contre la COVID-19 montrent que le prolongement des intervalles au-delà de ceux initialement autorisés entraîne des réponses immunitaires plus fortes, ce qui confère une protection encore meilleure contre l'infection à la COVID-19 et les résultats graves. Même si notre protection contre la COVID-19 a été renforcée par les vaccins, nous devons aussi penser à nous protéger contre d'autres infections à l'approche de la saison des infections respiratoires. En plus de recevoir les vaccins recommandés, comme le vaccin contre la grippe et ceux qui sont prévus au calendrier de vaccination pour les enfants et les adultes, nous pouvons prendre d'autres mesures pour rester en bonne santé, comme porter un masque, se laver les mains, tousser dans le creux du bras, optimiser la ventilation des espaces intérieurs et rester à la maison et à l'écart des autres si nous présentons des symptômes. Le fait de maintenir nos habitudes simples et bien rodées pendant l'automne et l'hiver nous permettra d'être en meilleure santé et d'atténuer la pression sur le système de santé en vue d'une reprise à long terme en douceur. Cela vaut aussi pour la planification d'activités sociales dont l'Halloween. Grâce à notre grande créativité canadienne, nous pouvons faire en sorte que les enfants et ceux qui ont un cœur d'enfant aient du plaisir et profitent de cette tradition spéciale en toute sécurité. Merci. Thank you. Miigwech.
Merci, Dr. Tam et Dr. New. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and one follow-up. We will be taking your questions in both official languages. Nous allons prendre des questions. Nous vous demandons de vous limiter à une question et une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. Opérateur, first question.
Merci, thank you. La première question, la first question est de Louis Blouin, Radio-Canada. À vous la parole.
Oui, bonjour, Dr. Nou. Écoutez, j'ai une question pour vous. Les plus récents chiffres de l'Institut national de la santé publique du Québec montre que plus du quart des parents d'enfants de 5 à 11 ans ne les feraient pas vacciner contre la COVID-19. Alors, je voudrais savoir, est-ce que ça fait partie de vos craintes que l'hésitation des parents nuise à la couverture vaccinale éventuellement des enfants?
Merci pour la question. Pour moi, c'est comme deux enjeux peut-être un peu différents. Pour les adultes, c'est toujours un enjeu pour encourager tous les adultes, les Canadiens et Canadiennes, aussi les jeunes adolescents à se faire vacciner. Et donc, on utilise tous les moyens. Je suis sûr que le gouvernement de Québec utilise tous les moyens pour encourager la vaccination, par exemple, les passeports vaccinaux pour permettre les personnes vaccinées à faire plus des activités. Donc, je pense que c'est un autre enjeu pour les enfants parce que les parents, pour protéger leurs enfants, il y a des autres peut-être enjeux, des autres préoccupations. Donc, je pense que la chose la plus importante, c'est pour le régulateur maintenant, avec la soumission de Pfizer, de faire leur propre travail, leur analyse rigoureuse, comme pour tous les autres vaccins visés pour les enfants, comme par exemple pour passer contre la rougeole, les oreillons, la polio, toutes les autres maladies infectieuses comme ça, pour assurer la sécurité et l'efficacité pour le vaccin pour les enfants. Je pense qu'après ça, si on reçoit l'approbation, c'est peut-être un autre moyen, des autres façons d'encourager les adultes pour peut-être se faire vacciner et protéger leurs enfants. Mais on n'est pas à cette étape encore. On continue à encourager les adultes à se faire vacciner. En même temps, on continue avec le régulateur pour faire leur analyse des données probantes avec la soumission de Pfizer.
J'aurais une autre question sur les voyages. Le gouvernement canadien a retiré sa mise en garde sur les voyages non essentiels en vigueur depuis le début de la pandémie. Qu'est-ce qui a changé pour que cette semaine, on décide de modifier cette politique, cette règle ou ces recommandations sur les voyages?
OK, merci pour la question. Oui, c'est sûr que la situation, la pandémie de COVID-19 continue à évoluer. Et je pense qu'en général, on peut dire que la situation ici au Canada, comparée au passé, et en général est mieux. Mais il ne faut pas oublier qu'on est encore dans la quatrième vague ici au Canada. Mais de bon côté, la couverture vaccinale est très, très élevée ici au Canada et on sait avec les données probantes que l'efficacité est bien éprouvée pour les personnes vaccinées pour protéger contre les conséquences graves, aussi les hospitalisations et le décès. Par contre, on sait que la situation n'est pas pareille. À travers le monde, il y a plusieurs régions dans le monde qui encore souffrent des conséquences graves de la COVID-19. Donc, on sait aussi, c'est une fait que les Canadiens ont hâte, peut-être commencent maintenant à prendre des décisions pour voyager pour toute une gamme de raisons. C'est toujours important. Si il faut voyager à l'étranger, de bien être au courant, c'est quoi les risques et les bénéfices pour un voyage. Première chose pour moi, c'est très important d'être entièrement vacciné parce que c'est la couche de protection la plus importante. Donc, ça, c'est une chose à considérer. Et aussi, l'état de santé, parce que si, peut-être, par exemple, vous êtes une personne avec une condition, vous êtes immunodéprimé, c'est une autre considération avant de peut-être prendre une décision à voyager. Donc, je pense qu'avec comment on dit, l'évolution de nos recommandations, ça, c'est quelque chose aussi à considérer que, OK, si on est complètement vacciné, aussi on est peut-être en pas mal bonne santé. C'est aussi une question de considérer c'est quoi la destination, parce que la situation épidémiologique, il y a beaucoup de variations entre les pays. Et même dans un pays, il y a aussi peut-être des différences d'une région à l'autre, même ici au Canada. Donc, c'est très important de considérer c'est quoi la situation épidémiologique. Si aussi on a peut-être aussi quelques renseignements concernant la couverture vaccinale à la destination, c'est aussi quelque chose à prendre en considération parce que c'est une indication, c'est quoi la transmission communautaire dans une région. À part de ça, c'est aussi important de peut-être savoir c'est quoi les mesures de santé publique en vigueur dans les autres pays, et aussi même les exigences à la frontière. Donc, il y a beaucoup de choses à considérer. Et aussi pour les Canadiens, si on voyage à une autre destination, il faut considérer c'est quoi les activités on veut faire. C'est peut-être que si on fait la randonnée dans la nature avec pas beaucoup de monde, c'est complètement différent si on considère prendre une croisière avec beaucoup de personnes dans un espace clos. Donc, c'est beaucoup de considérations. Et aussi, est-ce qu'on est à l'aise parce que peut-être on va dans un endroit où peut-être que la culture, peut-être que les mesures de protection individuelle n'est pas peut-être pareil comme ici au Canada, parce que est-ce qu'on est à l'aise à porter un masque? C'est toujours quelque chose qu'on recommande pour les personnes, des mesures de protection individuelle, mais si on va à une destination, peut-être où ce n'est pas peut-être le cas pour peut-être tout le monde, c'est aussi quelque chose à considérer parce que peut-être on se sent peut-être un peu mal à l'aise dans certains endroits. Donc, beaucoup de considérations et continue à évaluer et je pense prochainement, on va aussi mettre d'autres renseignements sur notre site web concernant aussi des outils pour peut-être avoir une idée c'est quoi les risques entre les pays dans le monde. Merci.
Thank you. Merci. The next question, la prochaine question is from Glenn McGregor de CTV News. À vous la parole.
Good morning. Now that Canadians are fully vaccinated who are free to travel, but the requirement for a PCR test 72 hours or sooner upon arrival is a major impediment for a lot of people just because of the cost. People will pay up to $200 US for that test. Family of four, that makes travel essentially impossible. And yet we hear that the data among fully vaccinated people who test positive is very, very low on those tests. Can you still defend this as a reasonable public health measure at this point, given how few people are testing positive, and the fact that it really does unfairly impact people who have lower incomes? They can't travel to the United States for short trips, for example, because the costs are so high. Do you see rescinding that recommendation or possibly replacing the requirement for a PCR test with a less expensive antigen test?
Yes, it's Teresa Tam here. I'll take this question. I think those are really great questions, and we'll be examining all of those dimensions. We have been, that's our prime objective, keeping Canada safe. And it is really amazing to see that Canadians have taken up the vaccine and follow public health advice. At the same time as the fact that we're just beginning to come down on this fourth wave, and we need to continue to exercise some degree of caution. But we will be examining all of those layers of protection. We also want to, as we have been doing, staged approach to easing our border measures using data and evidence. So we'll continue to do that. And also we're in the middle of consulting with the provinces as we speak, and on what the needs are for testing with regards to vaccinated travelers. I have to remind people that the pandemic is very much alive outside of Canada, and that many countries continue to require a pre-departure test, and it adds a layer of protection for any traveler, not just Canadians coming into Canada, but travelers from any corners of the world. So it is something that we will look at, but we are definitely not out of the woods yet. The next months, As I describe it, one would expect some ups and downs, some bumps along the way in our pandemic trajectory. And we just got to be a bit careful as we beginning to head into the winter season and trying to keep our schools, workplaces, and other socially and economically important spaces open as much as possible. We've got to be really careful if we are going to lift any layers of the protections pertaining to the border. But we are examining all of those measures as we speak.
As a follow-up, Ontario today is expected to announce they're going to easing back on capacity restrictions in restaurants, bars, gyms, and also maybe considering setting out a timeline for ending the mask mandate. And on those 2 points, what do you think of easing capacity or eliminating capacity restrictions on restaurants now in Ontario? And also, at what point do you think it would be safe for people to stop wearing masks in public places?
Well, first of all, the requirements in Ontario are best directed towards Ontario, the provincial government, because as you've seen across Canada, every province and territory has a different epidemiology at the moment. On the whole, though, as I said at the beginning of my presentation, is that we are beginning to see the downward side of the fourth wave. And I think Ontario would have assessed their own particular situation, which has been looking pretty good to date. And so I am sure that the public health officials will be monitoring COVID activity as they begin to ease these measures. And so I think slowly and gradually and continue to monitor the situation is very important. What we have learned, and through our modeling studies as well as, of course, real life experience, is that if everyone continued to wear masks in enclosed, crowded, close contact spaces and continue those personal hygienic measures, it can actually help reduce transmission rates in a community. So whether there is a mandate or not, I think adding those layers of protection can potentially help reduce the rate of resurgence and keep your community safe. So that would be my advice, and listen to your local public health authority because the activity is different everywhere. So if you got a lot of disease activity going on in your community, absolutely add on the extra layers of protection. And of course, as Dr. New has said, you've got to do your personal risk assessment as well. If you're at high risk of severe complications, you would take really great precautions, I think, as you're entering those, what we call the 3 C's, crowded, enclosed, and close contact spaces. And that's just the prudent way to get ourselves through the winter. And by the way, we did say that we're seeing other respiratory viruses escalating right now. Not yet influenza, but those viruses are escalating and they can have an impact on our health system as well. And that some people can get sick from other viruses. So adding on those layers of protection can only help to protect our health system as well. And of course, get the flu shot.
And it's Dr. New here. Maybe I just would add an additional point to what Dr. Tam has said, is that certainly our provincial territorial colleagues are all very live to the issue of the importance of continuing to monitor in terms of good surveillance and being able to pivot, because as they slowly maybe loosen restrictions and public health measures, if there's any indication that case counts are rising and hospitalizations and other indicators are starting to trend in the wrong direction, they need to be able to pivot quickly and long before obviously we get to stresses on the healthcare system. So I think that's the one point that I think everyone is now taking to heart, that we need to be able to adjust as quickly as need be as we slowly loosen public health measures. Thank you.
Thank you, Doctor. Next question.
Thank you, merci. The next question is from Laura Osman. La prochaine question is from Laura Osman. Please go ahead.
This morning, I had a question about sort of our supply of vaccine. As far as I can tell, we have about 20 million vaccine doses in Canada that haven't been used yet. I know we have new doses coming for children. We've signed contracts for new doses for boosters. So what is going to happen to our current supply that I presume is getting closer and closer to expiring, and we don't have agreements with the companies necessarily to donate them? Is there a plan for our current stockpile?
Yes, it's Teresa Tam here. Yes, absolutely. We've been working with the provinces and monitoring the supply situation on an ongoing basis. And of course, one of the underlying objectives is not to waste vaccines. They're a valuable commodity and extremely important to Canada, but also the world. So there have been arrangements, agreements that have been worked out, for example, between the COVAX facility, that's the global construct from the WHO, to facilitate donations as well as with the companies. So there are abilities, there are ways in which we can recuperate vaccines that haven't been used, that are still stored and managed in a controlled environment to be retrieved in order for us to provide that donation. And so we continue to work at that. You've heard some announcements already of the vaccines that we're donating from coming back out of Canada as we speak. So I think we are working all of this out just to make sure that we have enough vaccines should there be further recommendations on boosters for adults. So all of that is taken into account, but there are ways that we can donate this vaccine now, which has been worked out. The other measures include, for example, gathering information about shelf life of these vaccines. And this is normal process. Vaccines, as we learn how well they last, what we call shelf life, and still maintain their potency or efficacy, or potency really, then shelf life can be extended. And that's some of the work that Health Canada is doing with manufacturers. I don't know if Dr. Sharma, you would want to comment on that.
Thanks, Dr. Tam. So as we know more about the vaccines, and also as manufacturers make changes to their formulations, we get more information about how stable these vaccines are, how long they can be held on the shelf. And so currently at Health Canada, we do have a submission from Moderna to extend the shelf life of existing vaccines in Canada. So we're currently looking at that, and that would extend the shelf life from 7 months to 10 months. And they're also working on broader vaccines changes to their shelf life, as well as all the vaccine manufacturers continue to do additional stability testing and again make changes to the formulation. So there are different parts of it, what vaccines we currently have in Canada, how long they can be safely used, if they are not needed in Canada, as Dr. Tam has said, what would be donated, and then looking forward to other supply that's coming in, whether it's for existing populations or new populations. So all of that is something that we're actively monitoring, and if there is any changes to those shelf life, they would come into Health Canada. We would review that information and authorize if the data supported that.
Thank you. I wanted to ask as well about Moderna specifically. What is the process exactly for deciding when these doses get donated and how they get donated? And are there any complications with our Moderna doses, for example, because we don't have an agreement to donate those particular types of vaccines?
Yes, I can't give you the exact agreement or arrangement, but between the Government of Canada, the manufacturer, and the COVAX facility, we have an ability to donate. So that has been worked out.
Thank you, Dr. Tam. Next question. Question.
Thank you. The next question is from Reza Patel from the Toronto Star. Prochaine question de Reza Patel. À vous la parole. Please go ahead.
Thanks for your time today. We're seeing scientists in the UK urging the British government to speed up giving booster shots as cases rise there. Canada is obviously in a different situation than the UK, but you've been talking about extra layers of protection. Should we be considering a wider booster strategy here in Canada?
Thank you for that question. As you probably know, the National Advisory Committee on Immunization has already advised on providing an additional dose to people who have immunocompromising or immunosuppressed conditions. And they also made the next recommendation, which was to provide the booster doses to seniors in congregate living conditions. And they are continuing to look at the data, and we would expect them to provide further recommendations on boosters in the days to come. So they're actively reviewing that right now. And you're absolutely correct. Canada is, every country is just a little bit different in terms of the epidemiology, in terms of their vaccine strategy, which vaccine they use, and the interval between doses. So it's not the same for everyone, and we're monitoring our epidemiologic situation really carefully. And so, and also the manufacturers, of course, have submitted their information to Health Canada as the regulator for the booster doses. And so I don't know if Dr. Sharma would wish to comment on that.
Thanks, Dr. Tam. So yes, we do have submissions for a broader booster dose in the general population from both Moderna and Pfizer, but we're continuing to get additional information. So for example, Pfizer just today released clinical trial data from their boosters from a phase 3 trial on boosters that showed an increase in immunity up to 95.6% with those third doses. That's data we don't yet have. They've just released the sort of top line information from that studies, but we expect to get that filed to all of the regulators shortly. So we'll look through that data, both for Pfizer and for the Moderna vaccines, and then based on that, we'll take a look at authorizations. In that authorization, we do talk about what populations it makes sense to vaccinate, or which ones are supported by the data that we've seen. And as Dr. Tam has said already, the National Advisory Committee on Immunization also provides advice to the provinces and territories. So it's very much something that we're looking at. We are in a slightly different position than some other countries with respect to the intervals between the first and second doses. A lot of people in Canada had an extended interval between those doses, and that will actually likely serve us quite well in terms of the sustained immunity. So something that we're looking at right now in the submissions, and as soon as we have additional information, we'll share that. But both those submissions are actively being reviewed. Just to say that for the Pfizer submission, it is a third dose that's the same as the first and second dose, and with the Moderna submission, it's actually a half dose compared to what was provided for the first and second doses. So that's something that we're giving consideration to as well.
Thank you, Dr. Sharma. Just to add that, of course, as NACI contemplates the recommendation, the initial focus, as you may expect, is on the higher risk population, including the older age groups. And they were the first ones that we prioritized to be vaccinated in our vaccine rollout. And so we would expect perhaps some stage review between the higher risk groups first and then the rest of the general population. But just stay tuned and we'll have more. There'll be more to come in a short while.
Thank you. And in terms of a wider booster strategy that would open boosters up to more adults, what would maybe be the public health conditions or other circumstances that would necessitate more of the general population receiving a booster?
Well, I think, first of all, we are in a good position given that we're tracking vaccine effectiveness over time. You may have seen the studies coming out of British Columbia, coming from Quebec, and also Ontario and other areas of Canada that have informed not just us, but the world, in fact, on some of the evolution in terms of our vaccine effectiveness. Right now, vaccines are still very effective against severe outcomes. Because of the Delta variant, because of perhaps waning immunity, there is some reduction in the protection against infection. But so what we would expect is that the general population, especially younger individuals, some of them still haven't got their first dose. We need them to get their first primary series first. That's got to be a prime focus. But then they would have only just received that primary series, right? So they're much more recent. So we can take the time to observe what happens over time with the vaccine effectiveness for those age cohorts, for example, that didn't really complete their primary series until more recently. The interval between the second dose or the last dose for the primary series and the booster dose is also an important consideration. So just as today, NACI has come up with more information about the interval between the first and second doses, they will be doing a very thoughtful approach in recommending the interval between that last dose and the booster dose as well. And so for the bulk of the population, most people didn't complete that second dose until just a few months ago. So I don't even expect that we would be necessarily needing to examine that booster for the general population for a number of months. So we do have time to be thoughtful about it. And there is no supply issue.
Thank you, Dr. Tam. Next question. Prochaine question.
Thank you. Please press star 1 at this time if you have a question. N'hésitez pas à appuyer sur étoile 1 pour toute question. Next question is from Rachel Gilmore from Global News. La prochaine question est de Rachel Gilmore, Global News. À vous la parole. Please go ahead.
Hey, thanks for taking my question. I'm curious about travel. I mean, for months we've heard that standard line, now is not the time to travel. But does the change in the blanket advisory status mean you can tell Canadians today, go ahead, book that all-inclusive, it's time to travel again?
So thank you for the question. I think we're in the right now in a period of re-looking at a much more destination or country-specific approach as opposed to the global, more blanket approach, just to provide Canadians with more detailed information about their destination. But no, the pandemic is very much alive. There are definitely still risks involved in travel. The beginnings of the transition away from the more blanket approach really recognizes that vaccines are very effective at preventing severe outcomes, severe illness, hospitalizations, and deaths. And so in recognizing that and in strongly recommending a full vaccine series at least 14 days before traveling, we are essentially advising people to really be very mindful of that decision, get fully vaccinated, but also look at the risks involved in that travel journey and where you're heading to and the risks involved and your personal risk assessment. But no, now is not the time to just freely go wherever. I mean, you look at the world, many countries still have very sick. Sorry, can you hear me?
I can hear you.
Yeah. So just to say that if you're unvaccinated or partially vaccinated, you should continue to avoid non-essential travel. And so what we will be providing in the weeks to come is a more nuanced approach to people who've been vaccinated or unvaccinated, and looking at the global epidemiologic situation to provide people with more tools to make that assessment.
Great. Thank you for that. And for my second question on a totally different issue, contrary to what was said at the last briefing, Pfizer confirmed that the actual formulation of the pediatric vaccine is the same as that for adults, and only the dosage is different. Given that there's a global competition for the pediatric vaccine and we have supply ready to go in Canada that could go to waste, do you support using the adult supply for kids as soon as the regulator gives the green light?
So I'm going to start and then I'll turn to Dr. Sharma. So right now, as you've heard, the announcement, I think, by Minister Anand just a very short while ago, is that we already have made arrangements for the pediatric supply, enough for the 5 to 11-year-olds to get that first dose, that 2.9 million doses. So that is already planned. And it is not unusual to have different formats or formulations for pediatrics. And so our plan, really, our strategy is to utilize those pediatric dosages that we are making arrangements for, at the same time as doing everything that we can to minimize any wastage or any unused doses for the adult formulations. So I'll pass it over to Dr. Sharma about the Pfizer pediatric submission.
Thanks, Dr. Tam. So first to say that that submission is under review. It's for the 5 and 11-year-olds. As a pediatrician, we know that kids are not just little big people. They have their own considerations around risks and benefits of potentially getting COVID-19 versus risks and benefits of the vaccine. So it's something we take really seriously, and these are our children, collectively our children. So we want to make sure that we're reviewing all of this submission very, very carefully. We're working internationally with our counterparts, including being part of an expert group that will be discussing this specific issue next week, hosted by the US FDA. So just to say that that's ongoing. With respect to the formulation, it is slightly different formulation. So I think what Pfizer was noting is that the mRNA itself in the pediatric formulation is not different. It is the same mRNA. It sort of carries the same response, or it promotes the same immune response to the same spike protein, but it is at a lower dose. There are some other changes to the formulation as well. But as Dr. Tam said, really, using an adult dose and trying to then get a different dose. It is something that's possible. It is a bit of a workaround, and it can be tricky, especially if you have very small volumes, to make sure that you do that accurately, that you get the right dose, that the vaccine then has the same characteristics for safety and effectiveness as it would otherwise. So what we're saying is that there's no need for that workaround, that if there is a yes to the submission, if it's authorized, and just to say that it is an if, when you provide a submission to Health Canada for review, what you're guaranteed is a review. You're not guaranteed a yes. So we wouldn't authorize it unless it met the rigorous standards that we have to make sure that the benefits outweigh the risk. But if it does get a yes, we have we will be procuring enough doses for all children 5 to 11 to get that first dose. So, the bottom line is that regardless of what the changes are, there's no need to use those adult doses for pediatrics if it gets authorized. And those adult doses can be used for the adult population as intended. If we don't need them, they can be donated or used for other purposes. But really, it is best to use the authorized formulation for the population, for the group that you're going to be intending to use it in.
Thank you, Dr. Sharma. The next question will be the last. La prochaine question sera la dernière.
Thank you. Next question is from David Thurden from CBC News. À vous la parole. Please go ahead.
Hi, good morning. Thanks for taking my question. I'm just curious about the announcement from NACI today about vaccinations for people with allergic reactions to them. I'm just wondering, anecdotally, Dr. Tam or Dr. New, if you've been seeing an uptick in people saying that either they can't get any their first dose or their second dose because they have allergies. I know there's some doctors who've been saying that. So have you noticed an uptick in people saying that, hey, I can't get vaccinated because I have a possible allergic reaction?
I don't think we have specific data related to that statistic. But what I can say is, of course, Canadians have really embraced the public health advice to get vaccinated, and we have one of the highest vaccinated populations in the world. So that's great. We need to continue. So for the people who are worried because they've had a severe allergic reaction, either to a component of the vaccine previously or to that first dose of the mRNA vaccine, for example, they should consult with their allergists. What we are informing Canadians today through the examination of the data, the global data from the National Advisory Committee on Immunization, is that in fact, under a careful watch by a physician, under those controlled environments, you can safely administer another dose of vaccine in individuals who experience a severe immediate allergic reaction to that first dose. But it is a conversation that individuals should have with their physician. But that's good news in so many ways, because people who've been worried about, well, how do I complete my for the series of vaccines if I've had a severe allergic reaction to the first dose? Well, now there's an opportunity for some of these individuals to get their full protection from the full series. So do go and talk to your doctor. There are special advice, of course, for this population, not just to do this under the oversight or advice of the allergist or their physician, but to also be observed for at least 30 minutes after vaccination. And for general population, most people observe for 15 minutes. So just taking a bit more care, this population can be safely vaccinated as much as possible. And so I guess the bottom line is that we hope this is good news for people who've been worried about their allergic reactions.
It's Dr. New. Maybe the only other additional point I would make, and it's slightly a different issue, maybe that you're getting at, David, is about the sort of medical exemptions, for vaccination, and certainly, and sort of anecdotally, but then sort of some of the discussions we've had with our counterparts in the provinces, territories, they're looking very carefully in terms of, at what rate and how doctors are issuing a potential, medical exemptions based on, for example, reactions to the vaccine. And certainly it's something they're looking at closely, because there really are very few sort of true medical exemptions that could be valid reasons for not getting, a vaccine in the first place or a second dose. So probably refer you to the provinces and territories, but they're taking a close look at that to make sure that the truly only the really valid medical exemptions are issued for any type of, let's say, adverse reaction for vaccines. Thank you.
So are we to take from NACI's guidance that, an allergic reaction is not a valid exemption for getting a COVID-19 vaccine?
No, I like to clarify that, because it is an individual assessment with the allergist and the physician. If the physician deems that this person who's had a severe allergic reaction still can't take a vaccine, then they will have to provide a medical note to say that a severe allergic reaction or anaphylaxis is still a contraindication in the Health Canada product monograph and within the context of NACI. But it is advised just to give an opportunity for those with severe allergic reactions to get that second dose. So we do have to clarify that. But the individual physician will be able to assess whether there is an actual contraindication. But an anaphylaxis, a severe allergic reaction to a component, is considered a severe side effect that could qualify potentially for a medical exemption.
Thank you, Dr. Tam. This concludes today's press conference. Thank you for your participation. Any additional questions can be directed to the Media Relations at the Public Health Agency of Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à l'Agence de la santé publique du Canada. Merci et bonne journée. Thank you and have a nice day.
Thank you. Your conference has now ended. Please disconnect your lines at this time. We thank you for your participation. Votre conférence est maintenant terminée. Veuillez s'il vous plaît raccrocher votre ligne. Merci à tous les participants qui se sont joints.